This is a demonstration of Allscripts Professional EHR for family practice and internal medicine. Today we're going to demonstrate how Allscripts Professional EHR can overcome your daily challenges and help you achieve meaningful use. Many providers in family practice and internal medicine are challenged with tracking of lab results, disease management, medication management, maintenance of health screenings and testing, and having to document some problems over and over again. Professional EHR can help make your life a lot easier with quick and easy access to lab results, care management module for disease management, medication reconciliation, an automated alert for preventative health maintenance, and easy view and documentation of previous chronic visits. Now let's take a look at how Professional EHR can help meet your needs. You're logged in as Cindy Pope, who is the nurse for today's visit. Cindy is looking at the schedule for Dr. Manning. Here are all the patients listed on the schedule, the time of the patient's appointments, the time they checked in, the time the chart was started, and what time the patient checked out. Danielle Daniels is here today for a follow-up of her diabetes. Cindy will go in and document the history for the patient, patient's vitals, and any other pertinent information necessary to help meet meaningful use, and to document an up-to-date chart. This is the face sheet for Danielle, which shows the patient's problem list, her past surgeries, her allergies, her meds, and family history. So everything here is up to date and accurate. It also displays her encounters, her most recent office visits, the transitions of care, etc. Her current meds list is also displayed, as well as any orders that have been placed for this patient. To the left here is how you document. If you expand this, over to the left side, you will see icons that allow you to go in through the chart to document today's visit. The vitals. You're going to pull in the patient's previous height and weight. They're very quick and easy to update, meeting a meaningful use requirement for BMI. By pulling in the previous height and weight, it indicates that she's lost weight. That will be saved to her chart. For trending purposes, you can see her weight and her height as well as the calculation of her BMI here, listed and saved automatically. The patient's history has already been stored in the chart. Once you document the patient's history, it stays in the medical record. To include the history for today's visit, select Include Active. All of her history is dropped into a chart. To update, you select the item that is no longer valid and remove it from the record. The patient's allergy. She's allergic to sulfa drugs, but she's also allergic to peanuts. So you'll go to her short list, find the peanuts here in the list, select it, and then document that she gets a cough whenever she eats peanuts, and now you've updated the patient's chart. Same rule applies for any social history. She already has an up-to-date smoking assessment done. Her family history. If you want to go and update her family history, you can certainly do that by selecting that there is alcohol abuse on her father's side. Her medications list. Here you can see her current meds list. If you want to include these in today's visit, you simply select Include Current. It's dropped down to the patient's record. The fill history allows the provider to go and pull the patient's medications that have been prescribed by any provider in which she used her insurance to fill. When she used her insurance company to fill a prescription, it will be stored in the fill history and it can be pulled into the patient's current record. This means that her medication list has been reconciled and you've documented that and met a meaningful use requirement. Patient's review of systems. You're going to pull it from the previous visit. This allows you to see what was documented the last time you saw her. You select Apply, and that shows what was documented the last time, and nothing has changed. Why is she here today? You select the complaint. It pulls in again the last visit, and you document that this is a recheck. To view this note as it looks when it gets to the doctor's inbox, you'll see here at the top Danielle's demographic information, her HPI, why she is here today, for rechecking for diabetes, her list of problems, meds and allergies, her review of systems, and her vitals. Now you're ready to send the chart to Dr. Manning's inbox. The patient is roomed in exam room 6, and you'll put a sticky note on the chart indicating the patient is tired of waiting. Once the chart has been sent, it brings the nurse back to the schedule and then she can move on to the next patient. Let's take a look at Dr. Manning's inbox. Dr. Manning is now logged in. Over to the far right, you'll see a list of queues, and these indicate all the work that needs to be done today for Dr. Manning. Received charts shows where the patients are roomed and who's next to be seen. In this case, Danielle Daniels is in exam room 6. Open her chart. Immediately you receive a message that the patient is tired of waiting. You accept that, and now you're in the Patient Manager window. This window gives you up-to-date and real-time lab results that are back for her metabolic panel, her upcoming appointments, and then care management for her chronic diseases. Let's take a look at the lab results that are back for this patient. Her metabolic panel came back abnormal, which is why it is displayed in red. Select Review. It allows you to see those results, sign off on the labs, and if you wanted to publish these to the patient portal to give the patient information, you can certainly do that here automatically as well. It also allows you to send a message to the nurse. To sign off, you select OK, and now the results have been signed. The care management guidelines for her diabetes give you all of the guidelines that you need to follow according to the American Diabetes Association. Her A1C is overdue. If you want to trend any other results, you can certainly do that. If you want to trend her blood pressures over a period of time, you can trend those and see how she's doing. The guidelines are here as an automatic function for disease management. Now let's take a peek again at the note before going in to see the patient. Danielle answered demographic information. She's here for a recheck of her diabetes, the last time you saw her, and her history, including her vitals. The doctor is now ready to see the patient. He will select the chief complaint, why is the patient here again, and add an update based on his conversation with the patient in the exam room. The patient indicates additional symptoms, such as fatigue. Before, she mentioned she had extremity numbness. Now she also has extremity pain. So by selecting the checkbox, it actually adds it very quickly and easily to your note here at the bottom, and any other things that you want to do. Moving forward, you jump right to the physical examination. Again, pull in the previous visit and apply it to today's visit. If there's anything different, you can go in and make those changes as you indicated earlier. So let's document that in her monofilament exam. Again, this patient does have some numbness in the ball of her foot. You do an examination on that, indicate those findings, and mark it red to show that she cannot feel this area on her foot. However, maybe she's had improvement on her right foot. So it's that simple to make the change. It's reflected in your documentation here in the physical exam. The final piece under the Assessment and Plan shows this patient's current problem list. So it is very easy for you to go, look in the past to see what you documented the last time you saw this patient. Here's her treatment plan. You can select it, drop it into today's visit, and everything pulls in, including her lab orders that you want to place for today. You want to give her another education sheet because she lost the last one since the last visit. You want her to come back in 3 months, and you're also prescribing her Actos, which is covered under her formulary, indicated by the green check mark. At this point, if finished with the visit, you're going to go ahead and sign off on it. You want to run the E&M calculator, which will suggest the level of service based off of your template documentation. Select that this is a stable condition. You wrote the prescription, and you'll calculate. Based on your calculations, it's a 99212. If you look at the summary, it tells you exactly why you're at 99212. The history was detailed. Here's what you've documented. To achieve a comprehensive level, you have to document at least 10 review of systems where you've documented only 6. The doctor does have the ability to override what the system is suggesting. You're going to accept the 99212, sign off on this visit, and now this has generated your super bill, the office visit code along with the ICD-9 code and the billing codes for the labs. The encounter pack indicates items that you may want to print or fax out immediately after the visit. One of those things that need to be met for meaningful use is the clinical summary. The clinical summary says that you need to actually generate a summary of the visit to the patient at the end of every visit, and this is already built into the system. You can also write that prescription and e-prescribe it immediately after signing off on this visit or prior to signing off. Here's the actual prescription. This patient's preferred pharmacy is Ralph's. Here's the actual prescription pad for Actos with the doctor's signature already in place. If you also want to enter it in a mail-order pharmacy, you can also do that as well. The clinical summary for the patient will generate and be printed off at the time of checkout. Here's an example of the clinical summary, again already pre-built with the software. It pulls information from the progress note that you just completed and pulls it right into the clinical summary for the patient, indicating her medical problems, her meds list, etc. This will be stored to the patient's chart. Now you sign off on the chart, and the chart has been filed back into the patient's record. Allscripts Professional EHR not only addresses your daily challenges, but also connects you to 180,000 physician users, or 1 in 3 physicians, 1,500 hospitals, third-party devices and applications, labs and pharmacies across the country. The Allscripts Practice Management Solution seamlessly. The Allscripts Referral Network. To patients through the patient portal. To patients' charts remotely with Allscripts Remote for Apple iPhone, iPod Touch, BlackBerry, or any Windows mobile device. It is your entire healthcare community connected. To request a custom ROI assessment or a personal product demonstration, please call Allscripts at 1-877-EHR-NOW1 or email ehrnow@allscripts.com or visit allscripts.com.